is Eric Gillespie, and I am a practicing pharmacist residing in Cincinnati, Ohio. Thank you for taking the time to both organize and attend this listening tour. As a result of last year's ballot initiative, the topic of marijuana has been thrust to the forefront. It inspires me to see both the attention and effort the state legislator is putting forth to get it right on such a diverse topic. Legislation on this topic will be problematic. Hopefully this listening tour will afford you the ideas and opinions from people across the state, resulting in a movement all fair-minded citizens can get behind. As I stated before, my name is Eric Gillespie. I began working as a delivery boy in 1999 at Hart Pharmacy, an independent on the west side of Cincinnati, and have worked there ever since. I slowly moved up the chain of command, and through several twists and turns, I became a staff pharmacist there after graduating from the University of Cincinnati College of Pharmacy in 2012. On the horizon is becoming part owner in the next 5 to 10 years, alongside 2 of the daughters of the current ownership. Starting in my pharmacy college years, I became active in the Ohio Pharmacists Association and have continued my growth within the organization. Currently, I am a District 6 trustee of OPA, on the OPA Board of Trustees and Vice President of the Independent Special Interest Group. Being both a medical professional sworn to do no harm, and having grown up in an era where the stigma for marijuana use is tempered significantly, has left me conflicted in my overall opinion in the legalization of marijuana. I can both advocate and oppose both sides of the argument. Being stuck in this middle ground, however, makes me even more interested in the possibility of medical marijuana legislation. I see this as a safe step moving forward, one where we can get true medical sense and understanding through research and observation on the effects of the unprocessed marijuana plant. Currently, there is the dronabinol that is available that's a cannabinoid derivative, so this is more for the process. We can get all the anecdotal evidence we could fathom on how marijuana is as innocuous as putting pepper on your morning eggs, but as we all know from a medical standpoint, this could be farther from the truth. Having stated I am enthusiastically in support of the medical marijuana approval, I have some concerns and thoughts that I would like to share with you. First, I fear there should be a limited and finite number of approved disease states for the use of marijuana. Legislation lifting legal penalty with marijuana will be exploited as soon as it is law. Significantly defining the situations of sanctioned use will help both to limit exploitation of the law, but more importantly, maintain those who could truly see the benefit from the medication still have access to it. Second, monitoring of drug dispensing, much of the way WARDS is used today to monitor opioids. Attached to this is the ability to quantify and qualify the drug in a manner all medical professionals can understand. WARDS has been an excellent tool in decreasing illicit prescription drug use, and I see no reason not to use that model and take full advantage of its potential in monitoring with regards to the medical marijuana. Third, continued research into the medication's efficacy and safety. We are subverting many ways the typical drug approval and presentation to the public. Current standards call for 3 phases of trials and additional post-marketing studies. I am in support of this detour in this case. However, my true interest in medical marijuana is taking an in-depth look at its effectiveness in treating specific disease states. This is only done in conjunction with studies. Fourth, adequate liability for both the pharmacist and physician involved in prescribing, dispensing, counseling, and overseeing the use of the medication. All hold state certifications, however, we are also nationally certified. I am in support, we will be hard-pressed to find participants regarding medical marijuana use if you seek men and women that have to put their livelihood on the line, as marijuana is still considered illegal in the federal sense. Lastly, and kind of most personally, is my concern with the pharmacist's role in this potential program. The pharmacist has maintained either first or second in most trusted profession going back 10 years and beyond. The patient is the center of our profession. With that, the pharmacist should maintain the role of being the final check before dispensing medical marijuana. I have no delusions that CVS, Kroger, Giant Eagle, Hart Pharmacy will have shelves dedicated to Maui Wabi or Purple Haze or Kush number 9. However, a pharmacist, as an individual practitioner, independent of the pharmacy, should be utilized to do final verification, review, and counseling.